Hey everyone and welcome. Today we're diving into a tiny drop that has made a huge impact on eye health. We are talking about Latanoprost, a truly groundbreaking medication that's become one of the first lines of defense in the fight to save people's vision.
It's a really powerful question, isn't it? And with glaucoma being a leading cause of irreversible blindness all over the world, affecting millions, this isn't just some hypothetical. For so many people, this one single daily drop is exactly what stands between them and losing their sight. So how does it pull it off? Let's get into it.
Okay, so to understand the solution, first we have to really get our heads around the problem. And when it comes to glaucoma, it all boils down to one thing: pressure. Not the stress of a long week, but actual physical pressure building up inside your eye.
You know how we talk about blood pressure? Well, think of this as eye pressure. It's called intraocular pressure, or IOP for short. A healthy eye keeps its pressure nice and stable, but when that pressure gets too high, it starts to squeeze and damage the super delicate optic nerve, which is basically the data cable connecting your eye to your brain.
So, why does the pressure build up in the first place? Well, your eye is constantly making this fluid called aqueous humor. And normally, it drains out at about the same rate it's made. But with glaucoma, the drain gets kind of clogged up. The fluid starts to back up, the pressure rises, and that puts the optic nerve in real danger.
And that is where our breakthrough in a bottle comes into play. Latanoprost was just a massive step forward in eye care because it gave us a super effective and incredibly convenient way to tackle this whole pressure problem head-on.
So what is this stuff really? Latanoprost is what's called a prostaglandin analog. Now, that's just a fancy way of saying it's a man-made compound that mimics your body's own natural chemicals to help get that fluid draining again. And the best part, for most people, it's a simple once-a-day dose. That's it. This medication is typically prescribed for two main groups. First, you've got patients with open-angle glaucoma, which is by far the most common type of the disease. And second, it's for people with something called ocular hypertension. That's when you have that high eye pressure, but it hasn't started damaging the nerve yet. Using latanoprost here can actually help prevent glaucoma from ever even developing. So how in the world does one little drop make such a big difference? The science behind it is just fascinating. It doesn't just try to unclog that main drain. It does something way cleverer. It actually opens up a whole new escape route for the fluid.
So first, let's reintroduce the main character in this whole story, the aqueous humor. This is the fluid we've been talking about. And the entire goal of the treatment is to get this fluid draining like it's supposed to, so we can get that pressure inside the eye back down to a safe level.
Okay, here's a fantastic way to picture this. Imagine your eye is a sink, and the main drain is slow, so water is starting to back up. Latanoprost doesn't really mess with that main drain. Instead, what it does is open up a completely different secondary drainage pathway. It's like opening up an emergency overflow valve to let all that pressure out.
So how does it pop open that valve? Well, when the drop gets in your eye, it latches onto these specific receptors. This sets off a chain reaction that basically remodels or loosens up the tissues in that secondary drain, making it way easier for fluid to flow through. And the result is, you guessed it, a huge increase in outflow.
And the payoff for all that clever science is a big one. People using latanoprost can see their eye pressure drop by 25 to 35%. I mean, that is a significant reduction, and it's often exactly what's needed to take the strain off the optic nerve and protect their sight long-term.
But of course, a drug this powerful only works if it's used correctly. Getting the administration right isn't just about making sure it works, it's also absolutely key to minimizing any potential side effects.
The technique here is vital. You'll tilt your head back, make a little pouch with your lower eyelid, and pop one drop in. But listen, the most crucial part is that last step. By gently pressing on the inner corner of your eye, you're doing something called punctal occlusion. This blocks the tear duct and stops the medicine from getting into your bloodstream, keeping it right there in the eye where it needs to do its job.
And for all you contact lens wearers out there is a non-negotiable rule. The preservative in most of these drops can actually get soaked up by soft lenses, so you have to take your lenses out, put the drop in, and then wait a full 15 minutes before you even think about putting them back in. Okay, now let's talk about the other side of the coin. Latanoprost is usually tolerated really well, but it's famous for some very unique and important side effects that anyone using it really needs to know about.
So, the key is to know the difference between what's common and kind of expected versus what's rare but could be a serious warning sign,
While the most common side effects are mostly cosmetic, there are definitely a few symptoms that mean you should call your doctor right away.
These are the changes Latanoprost is most famous for. It can permanently make your iris darker, so a blue or green eye might slowly turn more brown over months or even years. It also has this well-known effect of making eyelashes grow longer, thicker, and darker. Now, while these changes aren't harmful, they are very often irreversible.
On the other hand, these symptoms are rare, but they are serious. Any signs of inflammation in the eye, sudden changes in your vision, or any severe reactions like chest pain or a bad rash, that is not normal. If you experience any of these, you need to get medical help immediately.
All right, before we wrap this up, let's just go over a few final but absolutely essential rules for using this medication safely and really getting the most out of your treatment.
Think of this as your final safety checklist. Always keep that dropper tip sterile. Don't let it touch anything. If you use other eye drops, give it at least 5 minutes between them. Be aware that your vision might get a little blurry for a bit right after you put the drop in. And always, always tell your doctor about your full medical history and if you're pregnant or breastfeeding.
You know, this quote really just nails it. Despite the unique side effects, Latanoprost's powerful punch against eye pressure, combined with that super simple once-a-day schedule, has made it a true cornerstone of modern glaucoma treatment and a first choice for doctors all over the world.
So, we've got a simple daily drop with a complex, powerful, and sometimes cosmetic effect. It's an incredible tool that we have right now, and it leaves us with a really exciting question. As we understand more and more about how the eye works, what other amazing pathways are we going to unlock to protect our vision in the future?